it's Andrea Tooley from AndreaTooley.com. Thanks so much for watching. Don't forget to subscribe to this channel so you never miss a video. I have a great one for you today. I am with one of my awesome and longtime college friends, Dr. Jake Capito, and he is going to give you tons of amazing tips today and answer some of your questions. So, hi Jake, thanks so much for being here with us today.
Hey Andrea, thanks so much for having me. It's so good to see you, and yeah, I'm just happy to be here.
Yeah, so I think before we kind of dive into the specific questions I have for you, can you just kind of introduce yourself and tell us, you know, where you're from and what you're doing and things like that?
Yeah, absolutely. So, hey everybody, I'm Jake Capito. I am originally from Fort Wayne, Indiana, and went to Butler University, and that's how I met Andrea here. I was a pre-medical student there and played soccer as well, and then I ended up going to the Indiana University School of Medicine and just graduated this past May, and now I am in my first year of residency as an emergency medicine resident.
That is awesome. And for those of you who don't know, the IU emergency medicine program is like the best in the country, so Jake is amazing, and he was like top of his class in medical school. He's just like the best ever. So I'm so honored to have him here to give you guys advice. So true. And Jake, I wanted to specifically have you on, not only because you're just an amazing student and now doctor, but
Woo.
Yeah, I've gotten a ton of email questions, and I've been doing this Email Monday thing where I'm answering reader emails. And I have several of people asking about playing sports in college if they're pre-med, and kind of how to balance such a time commitment with being on a team, and whether or not that's a good decision if you're pre-med. And since you played soccer at Butler and you were really involved, I thought you'd be perfect to kind of shed some light on how you did it successfully.
Yeah, absolutely. I'm happy to answer any questions, and hopefully I can help any listeners out there make a decision on to definitely play sports in college and to be pre-med if possible. So,
okay. Why don't you just tell us kind of how you got started at Butler? Were you always pre-med? Did you always know you wanted to play soccer? How did that all kind of transpire at the beginning?
yeah, so I definitely was a soccer player before I was an aspiring physician. I'll definitely say that. So I played soccer all my life, starting when I was about 5, and knew I always wanted to go play in college as well. And I don't think it was about until high school that I realized that I didn't have that light bulb or anything that just sparked, but I knew at some point in time I wanted to be a doctor, and there was no way I was going to give up soccer. So I decided I have to do both. And when the time came and high school ended, I went to a bunch of soccer tryouts and recruiting places, and what I found was that I was going to be able to play both soccer and do medicine in college. And so when the time came right, I was able to sign with Butler University, and I felt that was the best option for me, both from a athletic standpoint and a academic standpoint, and that's where I ended up, and I couldn't be happier. So
great. Were you nervous going into school being pre-med and playing soccer? Like, how did you kind of decide you were going to prioritize, and what did you end up doing? Like, what was it like?
Yeah, I definitely was nervous. I knew that it was going to be completely different than high school, and there wasn't really going to be much to prepare me for that. So I wasn't really sure what to expect, but I also knew that being a student athlete, I was going to have to balance both of them. And so one thing I did very early on is that soccer started before school started. And so I was able to sit down with my coach and really have a good chat with him on my goals for the year, what I planned, my goals for my lifelong goals and my career aspirations. And it was able to be level with him, and he was able to understand kind of my future plans, and knowing that I wanted to become a physician at some point and that I was working for that. And so he really understood where I was coming from, and I felt like establishing that relationship and that understanding early on was helpful for the rest of the 4 years. So
that's a really good tip, because then he knew what to expect of you, and
absolutely,
that's really smart. Okay. And then What did you major in college? What did you do for pre-med?
Yeah, so I was a biology major.
Okay, all right. And what was it like balancing the course load with practice and games? Like, how did you do that?
Absolutely. I think it was definitely one of the more difficult things I've done. At times, you're traveling while you're in season, you're gone for 3 or 4 days at a time, you're missing classes, you're missing labs, you feel like you're behind everybody else. But at the same time, you're in this community of people who really understand your goals and what you're doing, and they're supporting you, and you get to have this privilege of playing the game that you love, but at the same time studying to do something that you want to do for the rest of your life. And I think the balance is definitely difficult at times, but I wouldn't take it back for anything.
That's such a great attitude. I mean, what a great way to think about it.
Yeah.
How did you kind of get through those tough times studying? Like, did you learn how to prioritize things, or like study more efficiently, or did you have to study on the bus on the way to events? What did you do?
Yeah, you hit it pretty much right there. So getting into more of the specifics, without a doubt, when you travel and you're doing all this traveling while you're in season and even out of season at times, you're definitely taking all your books with you. So everywhere I went, whether we were gone for a day, 2 days, 3 days, whatever it was, I always took my books and I always took my notes. And I think one of the cons about it is that often when you would like to be hanging out with the guys or your fellow teammates, you're studying instead. And so a lot of times on the bus, I would be studying. And I had one of my best friends, Matt, and he was doing the same thing. So we would always sit together. We would always room together. And so we'd always study together too and be on the same schedule. But definitely, I would study a lot while I was on the bus. After team meetings, we'd go back to the room. And at night, instead of watching movies or talking with the guys or hanging out with the guys, I'd often just go back to the room and do some reading and wake up the next morning and do kind of the same thing. But so you have to stay disciplined, but there's always time to do it. It definitely is a balance, and I think if you're strong-willed enough and you're disciplined enough, you can make it happen, and it's definitely doable.
That is dedication to turn down movies with the guys to go study science. Wow.
Yeah, kind of boring at times, but it's definitely paid off now. So.
Yeah. Do you think that it has kind of shaped who you are as a student or who you are as a person? Like, did that experience kind of, I don't know, I guess just have an influence on who you ended up being? Like, I feel like that discipline that you had to have would have taught you so much and really helped you probably in med school a lot. Yeah,
absolutely. And I think that is the one thing I would recommend to your viewers and your listeners, is that it definitely is going to shape, those 4 years will shape who you are as a person, your character, and it will kind of shape the qualities you have as you transition into a physician. And one of the things that I definitely loved about playing soccer in college was that it made me become more confident in myself. I had to be more of a communicator, and as you're speaking with patients from all walks of life, it definitely helped in my communication skills. It definitely helped in my discipline when it came to medical school, having to really put in the time, the effort, and the hard work to study and do all of those things. And another one thing I think that it definitely helps us is becoming a leader. And when you can be a leader both on the field, and then you can take those skills to the emergency room or to the operating room, whatever it is that you love. I think that definitely helps, and I think those 4 years of being an athlete definitely mold you into a person that helps you become a better physician.
Yeah. Okay. And what was the transition from college to med school like? Do you feel like you were prepared, or being an athlete and having to make some of those sacrifices, do you feel like you were behind? Or I feel like you probably would have been even more prepared just because you had to be a champion studier. And what was that like starting med school?
Yeah, and I think you remember it probably just as well, is that there's not too much that can really prepare you for medical school. I think it's a whole nother world. But I will say, I think having that discipline, and like you said, the sacrifice, being able to kind of make some of the sacrifices of I can't go out tonight because I've got to study because I was at practice today. And so having to balance those sacrifices and make those sacrifices as well definitely played a role when it came to transitioning to medical school.
Yeah.
And it didn't seem so hard to make those sacrifices because you had been doing it for the past 4 years. So I think it made that transition definitely a bit easier.
Okay.
In terms of the workload and all of those things. I'm not sure you can be really too prepared for it, but everybody gets through it, and everybody does it. So, but I think you're right. I think it definitely helped, and it made the transition a lot easier and a bit more smooth as well.
Okay. Do you think that being a student athlete in college helped you get into med school? Like, I bet you talked about it during your interviews, and it was a big part of your application. Do you think it helped or hurt or kind of didn't make a difference?
Of course. I think it was a huge help, to be honest. I definitely used it a lot when it came to writing, putting things on my resume, my CV. And when I did my interviews as well, a lot of times that's all we would talk about. And it was kind of fascinating, the connections you would make. And even when it turned into doing interviews for residency, that was often the topic, was going back to college and making connections with maybe some of the staff that you were interviewing with who also were athletes in undergrad as well. And it just made for easier conversation. It made for a lighter mood. It made for just an easier interview overall. And I definitely think it helped because I think people were able to try to understand the difficulty of being an athlete and studying for medical school. Mm-hmm. And I think overall, I think it was definitely beneficial, and it definitely was helpful when it came to interviewing and getting into medical school for sure.
Yeah, I can see that for sure because that's your thing, and it makes you so unique. And just to see that you can be successful in college and like get good grades and do well in the MCAT, meanwhile you're playing soccer all the time and having to balance, like, I feel like that just shows what an outstanding person you are, and you know how remarkable. I think that's really great. And
thanks, Andrea. I appreciate it.
I mean, you're amazing, Jake. But and even that they talked about it during your residency interviews. That's really good.
Yeah.
And so speaking of residency, maybe you can just tell us a little like why you chose emergency medicine or what that's been like so far, because you just started a couple months ago.
Yep, it's fresh, it's new, and it's been quite the experience already. So, as far as emergency medicine goes, I think, to be honest with you, Andrea, I was late in my decision of deciding what exactly I wanted to do, and I was kind of one of those students that was, you know, if someone pushed me into something, I probably would have done it. I loved everything. I had a good time in most rotations, and just couldn't really decide on, you know, that famous question of what do you want to do for the next 30 years of your life. And what I loved about emergency medicine that really drew me to it was it didn't really make me answer that 30-year question. And just to kind of talk about that a little bit more is some of the cool things about emergency medicine is, one, you get to see everything. Yeah. You may not be an expert in anything. You can choose to find your niche. You may not be an expert in anything like a subspecialty surgeon or an ophthalmologist like you or anything like that. But what it does allow you to do is it be kind of like a jack of all trades. It allows you to be a very practical physician. And that was one thing I told myself. I want to be able to see anything that comes in the door and be able to stabilize that, have an idea of what's going on and what to do about it. Yeah. I may not be always able to fix the problem, but I can definitely help. And sometimes you are the one to fix the problem or the one to make the diagnosis, because you get the luxury of being the first person to see the patient. So that was one thing I loved, is it allowed you to see everything and be practical. The other thing that I definitely love is that emergency medicine definitely has a unique lifestyle. They work shift work, so the hours can be crazy, but at the same time, it frees up a lot of time for you to do something else in life too. Right. I absolutely love medicine, but I think somewhere down the road, it gives you the opportunity to, you know, start a clinic overseas or, you know, be an entrepreneur in business or some other thing. I think emergency medicine physicians are always leading the way in something outside of medicine as well, whether they're active in their community. or playing a role in the hospital administration. And so I think it gives you a lot of opportunities to do something outside of medicine too, and I love that. And lastly, I think I just love the people in emergency medicine. They're cool people. They're the one climbing the tallest mountains in the world. They're the ones scuba diving, snorkeling, flying planes, and that's just kind of my lifestyle. That's what I love to do. Kind of be real adventurous, and so I really gravitated towards those people as well.
That's such a good answer. Everything you said is like spot on. I mean, I only spent a month in the emergency room as an intern, but what you said is just spot on. And I'm really glad that you found your little niche and the area that's going to make you happy. Because you're right. I remember you liking everything and kind of debating lots of different specialties. And
I think the other cool thing, too, is that so many people go on to do more than just emergency medicine in terms of now there's avenues for critical care, sports medicine, toxicology. And I think most people, emergency medicine they don't find out about it until later in their medical school career. And then they don't tend to understand that there's so many options even after a residency of emergency medicine. And I love still having that ability to still choose something like critical care afterwards and to do both as a future career. So
yeah, really good point. Awesome. Okay, well, I think we're coming up towards the end. Before I let you go, I just want to pick your brain for all of the aspiring pre-meds out there. You've given us a ton of amazing advice, like be disciplined, you have to understand you have to make sacrifices, like don't sacrifice your goals. If that's what you want, just do it. I mean, you've given us so many amazing tips. Anything else you maybe wish you would have known in college about med school, or any like secrets to success, things that you think really helped you out along the way? Anything you want to impart onto the world of YouTube?
Ooh, that's a great question, and a broad one too. So I've seen some of your videos, and they are all awesome, and I know they're definitely helping out all your viewers and listeners and all the pre-med world. So that is awesome. And one of the points that I would say, tips to help you be successful, is there's more to life than just medicine. And in order to be a good physician, you got to be healthy yourself, and you've got to take care of yourself. And that's one of the points I've seen in one of your older videos, and I think it's great. And I think one of those things that you get caught up when you're in the medical school mindset is that everything is about studying and grades, and yet when you look back, you realize that yes, that's so true, and you need to learn and you need to work hard, but there's so much more as well. And make sure that you stay healthy, make sure you take the time to keep your friends, connect with your family. Don't let those people fall to the wayside, and realize that you yourself have to be healthy and to have fun too. This is a long journey. It never ends. You're constantly learning. So make sure you're having fun with it, and don't forget those things. So
that's so great. I just love your whole attitude. I think that's amazing. For everybody listening, we can only hope to be as successful as Jake.
Oh, I don't know about that. Thanks, Andrea. I appreciate it. Just trying to follow you, that's all.
Oh, yeah. Well, thank you so much. I think people are going to love this video and learn a ton. And I'm glad everything's going so well for you.
Yeah, thanks for having me, Andrea. I really appreciate it. And I hope all your viewers benefit and continue to watch it, because you're a huge help to the pre-medical community. So
thanks, Jake.
Yeah.
All right, well, everybody, I hope you enjoyed this video. Don't forget to subscribe to this channel so that you never miss another video in the future. And if you want any more information, you can always find me on my blog, andreatooley.com, Instagram, or Twitter. And I will talk to you all later. Bye!